Well, I'd like to present to you our next speaker, Dr. Tennant. Dr. Tennant graduated from the University of Texas Southwestern Medical School with a medical degree and is founder and director of the Tennant Institute for Integrative Medicine. It's a clinic specializing in the treatment of chronic pain patients with microcurrent technology. He's an international lecturer and has numerous publications on ophthalmic surgery and pain management. Dr. Tennant has been training medical doctors and healthcare professionals on pain management since the year 2000 and was interviewed for the PBS documentary in 2013. Please welcome Dr. Tennant.
Okay, testing, does that work? All right, good morning. Well, it's great fun for me to be back with this group again. I've always thought it was sort of an interesting paradox for an ophthalmologist to be talking to dentists. But there is some connection, of course. You know, most physicians feel that the eyeball and the teeth are not really part of the body, so that ophthalmologists and dentists aren't real physicians anyway. So I guess there's some irony there. But I'm very grateful to be back and speaking with your group again. I have developed very many friends in this group, and you guys and gals continue to teach me a lot. I always begin my lectures by stating that I'm not speaking with my Texas MD license. The medical board in the state of Texas does not allow Texas physicians to discuss things that are not standard of care medicine. Which, of course, by definition is pharmaceuticals, surgery, and physical therapy. So today I'm speaking with my Arizona Integrative and Homeopathic Medicine license. Since I spoke to you last in Puerto Rico, there are a couple of things that I figured out that I wanted to share with you. So the first half of my lecture is going to be about cancer, and the second half is going to be about the gallbladder wisdom tooth adrenal syndrome. Now, the idea of there being voltage in the body is obviously not a new one. As a matter of fact, some of the oldest literature about healing involves the concepts of voltage. Everything from the Egyptians using electric eel to heal people, to magnetic fields inside of the pyramids, etc. But in more modern times, some of the books that have been written that were very influential in my thinking were The Secret of Life by Lakowski. Many of you know of Lakowski. He was one of the first people to use modern electronics to treat illnesses with his multi-wave oscillator, which was actually developed in collaboration with Tesla. And then, of course, there's the body electric that Robert Becker wrote, which was quite influential. And then I began this process in 2002 and 10 with my Healing is Voltage book, which has surprised me of the interest in it. There have been somewhere between around 10,000 copies of it sold so far. So there seems to be an interest, a reviving interest in this subject. And then finally, my most recent book is Healing is Voltage. And by the way, I must tell you, this disclaimer is I do have a financial interest in a product in my talk or with companies offering grant monies for this continuing dental and medical education program. Obviously, anything that has my name on it, it's likely that I have an interest in it. But finally, this Healing is Voltage book contains the atlas of the muscle battery packs that I'll be discussing with you shortly. Now, the idea of there being voltage in every cell in the body seems to still find resistance from many quarters, particularly allopathic medicine. So in allopathic medicine, we measure electrical current to determine life or death. For example, if you do an EEG and there's no electrical current there, we know that that person has died. More commonly, we measure the electrocardiogram, and of course, we have the normal one here, and then the so-called well-known straight line that indicates that the patient's died. But despite this, there continues to be resistance in the areas of medicine. The the idea that every cell needs voltage, not just the brain and the heart. So what I want to do with you in the beginning here is just to give you a quick summary of the electronical and electrical battery packs and power supplies that we have in all of our cells. This interesting diagram was created by Dr. Jara Altubiak in Kuwait. But as you can see, we have a battery pack within our mitochondria. We have a battery pack that's our cell membrane, and then we have our muscles, which are the largest battery pack in the body. So I'm going to discuss with you each one of these so that you begin to understand the various battery packs that we have in the body. Now, our mitochondria, of course, is the final common pathway for energy for the cell to do its work. And inside the mitochondria, we have a rechargeable battery system, which each of you know as ATP. When the battery is charged up, it's called ATP. When it's discharged, it's called ADP. And because we have a rechargeable battery system inside our mitochondria, we must have, guess what, a battery charger. And the battery charger is called, of course, the Krebs cycle, or the citric acid cycle. So, interestingly enough, for every unit of fatty acids that we put into the Krebs cycle, if we have oxygen available, then we get enough electrons to charge up 38 of these ATP batteries. If oxygen is diminished, then for every unit of fatty acids we put into the Krebs cycle, we only get enough electrons to charge up 2 of these batteries. So obviously, one of the things that's in major control of the voltage and energy necessary for our cells to work is oxygen. And as I'll point out to you shortly, what we find is that what controls primarily the amount of oxygen in the body is our old friend voltage. Because the amount of oxygen that will dissolve in water is dictated by the voltage of the water. Since our cells are 70% water, obviously voltage is in control of the amount of oxygen that's available. So we have then what's in control of the amount of energy we have for cells to work is the ATP, which is controlled in part by the availability of oxygen. But also the total number of mitochondria we have in the body is dictated by the thyroid hormone T3, not T4, but T3. And the function of the mitochondria itself is under control of the thyroid hormone T2, which is, by the way, one of the reasons that desiccated thyroid works so much better than synthetic T4 is that desiccated contains T3 and T2, which is our only source of T2. So we need, for this intracellular battery system to work, we need adequate amounts of thyroid hormone, and we have to have adequate amounts of oxygen, which, again, is controlled by our friend voltage. Now, the Bohr effect has to do with the fact that oxygen is attached to hemoglobin when the voltage is high or the pH is higher in the lungs, and what causes it to be released in the tissue is a drop in the voltage or a drop in the pH caused by CO2, and thus if we don't have CO2 in the periphery, then the oxygen has trouble dissociating from the hemoglobin. So now we've talked a little bit about the intracellular battery system. Let's take a look at the cell membrane battery system. So our cell membranes are capacitors. So what's a capacitor? A capacitor is really a small battery. That is to say that anytime you have two electron conductors separated by an insulator, you have a device that will store electrons. But the biggest difference between a capacitor and a battery is that a capacitor can discharge its entire amount of electrons immediately, whereas a battery can only do that slowly. But otherwise, they're similar batteries. Well, our cell membranes are made up of the very interesting mechanism where you have opposing sets of phospholipids. And phospholipid is a very interesting lipid because it has a ball with these 2 legs hanging down. The balls are electron conductors, the legs are insulators, so when you put them tail to tail like this, you create a capacitor. So our cell membranes are small batteries that have the ability then to provide more electrons into the intracellular mechanisms as well. Obviously, you want to be able to make good capacitors for your cell membranes and not make them out of plastic fats. You want to make them out of good fats. So that leads us then, now we've looked at the intracellular battery system, we've looked at the cell membrane battery system, but recall that both of these are rather small batteries. Neither of them can last very long. And because they're small batteries, we need an ongoing big battery system, and that turns out to be our muscles. Muscles are piezoelectric, and what does that funny word mean? Well, piezoelectric means that if you stress a material and that causes it to emit electrons, that's called piezoelectricity. So whenever I move my muscle like this, I'm generating electrons, which, by the way, is perhaps the most important thing that exercise does for you, and that is it's the way you are designed to recharge your personal battery pack, because our muscles are not only piezoelectric electron generators, they are rechargeable batteries. So each of you have a personal portable battery pack, and that is your muscles. But not only are your muscles your battery pack, it's important to recognize that our muscles are stacked one on top of each other in a very specific order. So when you stack specific muscles one on top of each other, it's very much like putting batteries in a flashlight. So every organ in the body has its own muscle battery pack. And a stack of muscle batteries is what's been called an acupuncture meridian. An acupuncture meridian is simply a specific stack of muscles that creates a battery pack for various organs in the body. So, for example, this one called the spleen meridian starts down in the big toe, goes up the inside of the leg, has a special branch over to the reproductive area. For the female genitalia, goes around to the back where it gets the power supply for the adrenals and the pancreas, and the spleen goes on up into the neck, makes a loop, hooks into what's called the stomach circuit. The stomach circuit then gets the frontal lobes of the brain, the motor strip of the brain, the macula of the eye, the cornea and eyelids, and then it gets the thyroid and parathyroid, of course, the breast, the stomach, the male genitalia, and then on back down to the big toe. So it makes a loop. So we have 6 of these loops of muscle batteries that provide all of the power, or the backup power, for every organ in the body to work. Now, one of the things that's important to remember is that the body's constantly wearing itself out and having to make new cells. So you get new cells in the macula of your eye every 48 hours. The lining of your gut's replaced every 3 days. The skin you're sitting in today is 6 weeks old. Your liver's 8 weeks old. Your nervous system's 8 months old, and so forth. So we're constantly wearing ourselves out. In my opinion, chronic disease only occurs when you lose the ability to make new cells at work. Okay? Chronic disease only occurs when you lose the ability to make new cells at work. So what's it take to make new cells? Well, cells are designed to run at minus 25 millivolts. Minus means electron donor. So cells run at 25 millivolts, but to make a new cell, you have to have 50 millivolts. Now, don't be confused. People will talk about cells running at 90 millivolts. If you put an electrode inside a cell and one outside the cell and measure the voltage across the cell membrane, you'll get 90 millivolts. But if you talk about the environment in which cells work, they run at minus 25 and they replace themselves at minus 50. So you have to have 50 millivolts in order to make a new cell. In addition, you have to have all of the materials it takes to make a cell, and of course that's where nutrition comes in. And then you have to deal with any of the toxins that damage cells as fast as you make them. And of course, the primary toxins that we have to deal with daily are dental infections, heavy metals, and GMO foods with their accompanying pesticide glyphosate, better known as Roundup. Those are the three most common toxins that we have to deal with. So we have to deal with voltage, we have to deal with nutrition, we have to deal with toxins. Well, so in almost any chronic disease that you have, you must ask the question, what is the power pack for that symptom? And once you ask that question and identify its power pack, namely its acupuncture or meridian, then you have to ask the question, why won't that power pack hold a charge? Because in essentially all chronic disease, you'll find that the power pack for that particular symptom or organ is unable to hold a charge. And therein lies the answer to essentially all chronic disease. And by the way, here are the power packs for the various portions of inside the oral cavity. And of course, we'll get to the specific teeth in just a moment. Now, one can measure any of the voltage in any of these battery packs by using these areas which I've called bioterminals, and you can see they're on the anterior part of the body, they're all on the midclavicular line and run along the side of the rectus abdominis muscle. On the back, they're on a line that is on the inner border of the scapula all the way down to the hip. And so one can use various devices, including my biomodulator, to go measure the voltage in any of these battery packs and confirm that it has low voltage. Now, one of the interesting things about the spleen-stomach circuit is that the spleen-stomach circuit is the power supply for the entire reproductive system in both male and female, for the entire endocrine system, for the frontal lobes, the thinking part of the brain, for the motor strip of the brain, for the macula and cornea of the eye. And so when you consider what I've just said, this is the power supply for many of the major things of the body, and certainly the major things that end up with illnesses, particularly as for example, in cancer, the most common cancer in women is breast, the most common cancer in men is prostate, both of which are on the spleen-stomach circuit. Well, now, around each of these battery packs, we have fascia. And Thomas Myers has shown that if you use blunt dissection instead of sharp dissection in cadavers, you will find that fascia surrounds this stack of muscle batteries. So you have an individual stocking of fascia that isolates each muscle battery pack. And this fascia is a semiconductor. So what's a semiconductor? A semiconductor is a collection of molecules designed in such a way that electrons can move through it at the speed of light, but only in one direction. So because our fascia is can move electrons and surrounds the batteries, so then our fascia becomes our body's wiring system. Our fascia is our body's wiring system. So, by the way, now that you understand that, if you go in and create a scar, of course, if it touches the fascia, it creates a short or a ground, which is why many people end up, by the way, I think that scars are the major cause of dental caries, but that's another subject that I don't have time to discuss in this short time today. But the point that I want to make is that each one of these muscle battery packs goes through very specific teeth. And so, for example, the battery pack we've been discussing, the spleen stomach, are these ones in yellow. So you can see it's the upper molars and lower premolars. Now, the interesting thing about teeth is I've come to realize that teeth act like circuit breakers. If I come home from work and I open the fridge and it's hot in there and I go in the living room and the lamp won't turn on and I go in the bedroom and the TV won't turn on, I realize that I've got a circuit breaker blown, right? Well, so it is with teeth. When you have an infection in a tooth, then that infection acts like a circuit breaker in the sense that it begins first to lower the voltage in that circuit and then eventually shut that voltage off. Because teeth act like circuit breakers, they become the controlling factor in almost all chronic disease because they control the voltage. Voltage controls oxygen. Oxygen controls the ability of ATP to work. Oxygen controls whether we have infections in the body or not. And eventually, oxygen is the determination of whether we get a malignancy, as I'll show you. So once you began to realize that teeth are circuit breakers, then you began to recognize that the teeth are really the guardians of our entire health and are essentially always involved in almost every serious chronic disease. Now, of course, there's a variation in how much effect it has on a circuit. A filling, an infection under a filling will have some effect. A big infection under a crown has an even bigger effect. Worse than that, of course, is a root canal. Root canal teeth, as you know, are dead teeth. And as you know, dentists are the only physicians that believe that you can get away with leaving dead tissue in the body. No other doctor really believes that. And because all dead tissue gets infected. And of course, here's the famous Japanese study where they did a root canal on people who are going to have wisdom teeth pulled. They did it on just one side, and then 150 days later, they pulled both teeth. And as you can see, the side where nothing was done, 1% of the tubules were infected, and the side where the root canal was done 150 days earlier, 39% of the root canal teeth were infected. And so all dead tissue gets infected. So if your big toe dies and you leave it there, you will die of gangrene. If your appendix dies and you leave it there, you'll die from peritonitis. If you have a root canal, it will also kill you. It just takes longer. So all dead tissue always gets infected. And of course, the other problem that we have is cavitations, which in my experience affect the circuitry in a way quite similar to root canals. So let's talk about cancer. During the 50 years that I've been in medicine, the theory has been that for some unknown reason, genes mutate, and the mutated genes cause cells to multiply rapidly, and that forms tumors, and that's caused cancer. With that theory in mind, the idea has been if you can go in and cut out those mutated genes and throw them away, you've cured the problem. If you can't do that, you use poisons that kill rapidly growing cells, and you've cured the problem. So this idea of mutated genes being the cause of cancer has been and continues to be the primary theory under which oncologists work. And of course, this theory was first presented by Boveri in 1902. Well, in 2013, it was proven by this gentleman, Tom Seyfried, that that's incorrect. Seyfried proved that mutated genes are not the cause of cancer. That mutated genes are a secondary phenomenon, but are not the cause. And the way he did that was he took cells that were malignant, removed their nucleus that contained mutated genes, and replaced them with a normal nucleus, assuming the cells would become normal. They did not. They stayed malignant. Then he did the opposite. They took normal cells, removed the normal nucleus, and put in a malignant nucleus, assuming that the cell would become malignant. It did not. It stayed normal. And this was repeated at multiple universities, thus proving that mutated genes are a secondary phenomenon and not what's driving the bus. This, of course, has forced us to look at and re-examine the reason that people get malignancies. And in the slides that have been handed out and that are in your workbook or that you can download, you will see that I've placed the history of cancer and various theories, but I'm not going to go over those at this very moment because of the compression of time. But what you'll find, in my view, is that the correct idea about how cancer works was first presented in 1838 by Mueller. Mueller recognized that cancer cells always come from stem cells, not from normal cells. Let me say that again. Normal cells do not become malignant. Stem cells are what develop the malignancies. Well, the first person to publish in modern times, at least, that there is a relationship between cancer and pregnancy was John Beard. Beard was a Scottish embryologist who in 1903 said that the cells that make a placenta are not part of the embryo itself, but are rather separate cells, and that they go out and invade the wall of the uterus, invade mother's blood supply, create a new, larger blood supply called the placenta. And that for some reason on day 54 of the pregnancy, the stem cell or these cells stood down, quit acting like they were malignant, and then the pregnancy proceeded as usual. So Beard was the first person to recognize that the cells, the stem cells, which he called trophoblasts, were indistinguishable both in appearance and in activity to those cells that form cancer. Beard went on to wonder why these cancer cells, or these cells that form the placenta, stood down on day 54, and eventually figured out that it was on that day that the fetal pancreas began to make its hormones. And so he began to treat first animals and then people with pancreatic enzymes, and found that he could easily cure both. His work, published in 1911, of course, was ignored until 1962, when a surgeon in Dearborn named Frank Shively cured 192 cancer cases with pancreatic enzymes, prompting the FDA to outlaw their use in this country. The reason that I think that works, of course, has to do with the fact that placentas, all cancers and most viruses, are surrounded by a protein substance called nagalase that shuts down the immune system. Well, the point that I want to make in the time that I have here is that the signal, both in a pregnancy and in cancer, that we are running out of oxygen has to do with voltage. And this was shown by Keith Brewer in his work back in the 70s, where Brewer showed that normal cells are running here at about minus 25 millivolts. But when you get down here to plus 30 millivolts is where cancer occurs. So Brewer didn't discuss it, but what you can see is that when you go from a pH that's above 7 to a pH that's below 7, you have reversed the polarity. That is to say, you've gone from electron donor to electron stealer. So cancer occurs when you flip the polarity, which, by the way, is exactly what happens in a pregnancy. If you look at both ova and sperm individually, separate and apart, each of them are running as they should at minus 25 millivolts. But when sperm is in the presence of estrogen, it opens pores and dumps out hydrogen ions and flips its polarity. And so this accomplishes, of course, two things. One is now you have a plus-minus attraction to the ovum. But secondly, it's I think, the switch that tells the local stem cells, hey, we just ran out of oxygen here. We need something, we need a mechanism to deal with the low amount of oxygen. So obviously we all can recognize that the uterine arteries are inadequate to support a growing pregnancy, and thus we need a mechanism to deal with this increased demand for oxygen, nutrients, etc., and we call that a placenta. Well, it turns out, I think that there's now increasing evidence that the body only has one mechanism to deal with lack of oxygen, and that is to make a placenta. So what you will find is that in all cases of malignancies, when you measure it, you will find that the battery power pack for that, the battery pack supplying that organ, say a breast, for example, has not only dropped its voltage, but has gone past zero and reversed its polarity. And it's the reversal of polarity that tells the local stem cells, hey guys, we just ran out of oxygen here, please help, in which case the local stem cells know what to do, and that is go make a placenta. So what you'll find, I think, is that all solid tumors are placentas. Now, the difference between a placenta inside the uterus and outside the uterus is only that inside the uterus there's a mechanism to keep it contained there, where a placenta that's formed outside the uterus has no such containing mechanism, and thus it can continue to spread. So what causes us to then develop a placenta to try to overcome the hypoxia is an accumulation of electron stealers. So if you look at electron stealers over here, dental infections, hypothyroid, scars, emotions, toxins, smoking, pesticides, pharmaceuticals, processed food, GMO foods, chemotherapy, and radiation. Over here, electron donors, we have ozone, alkaline water, uncooked food, sunshine, touching the earth, moving water, touching another living thing, love, removal of scars, dental infections, emotions, and so forth. And of course, there are devices such as mine that can help put in electrons. So you have this balance. So what I'm saying is that the reason it's been so difficult, I think, to identify the cause of cancer has been that it's not just one thing. It's an accumulation. It's the sum total of electron stealers to which your body gets exposed. And of course, the worst one of all is dental, because as Boyd Haley has so clearly shown, one root canal puts out such potent thioethers and gliotoxins that the toxins coming out of root canals and cavitations are equal in toxicity to hydrogen sulfide, the standard by which all biological toxins are measured. So what happens then is when we have a root canal or cavitation, it lowers the voltage significantly in that circuit, and then when we add in enough of these other things, we finally get to zero. And it's well known in battery technology that anytime you take a rechargeable battery and you drain it to zero, it flips its polarity. And so it's the flipping of polarity that says to stem cells, hey, we just ran out of oxygen here, please make us a placenta so we can try to stay alive. Well, obviously, when you began to think of cancer as something trying to keep your organs working, it changes the paradigm, doesn't it? It also explains why when you go in and remove a cancer or you kill it with whatever mechanism, if you did not address the oxygen levels, the body will, guess what? Make a new one. And that's what we see happen over and over. So again, I think the on switch for malignancies is a flipping of the polarity, which is the summary of electron stealers in that particular battery pack. Now, I looked at, a couple of years ago, I looked at the previous 50 cancer patients that we had seen and compared them with the dental pathology we found. And what we found is that 48 out of the 50 cases had a dental infection in the same acupuncture meridian as a primary cancer or a cavitation in the adjacent meridian. 96% of the cancer patients that I saw or that I continue to see have an infected tooth or a cavitation in the same acupuncture meridian or a cavitation in the adjacent meridian, 96%. So, for example, I walked in my exam room, I saw this patient that had this lesion on her cheek, and so I immediately knew that she had a root canal in the stomach meridian on that side. How did I know that? Well, as you can see, here's the battery pack for that area. And of course, her lesion's right there. And this is the stomach meridian. So I knew that there was a 96% likelihood that she had a root canal, and indeed she had one here in number 3. So that's what you begin to find anytime you start looking at this. So why doesn't everybody who has a root canal have a cancer? Well, as Boyd Haley has shown us, as I mentioned, one root canal shuts down 63% of your immune system. So let's make an assumption for a moment that this reduces the voltage by 63% as well. So let's assume that you make $1,000 a month, but there's a $630 a month tax. So you have $370 a month to live on. Well, you can do that. It's hard, but you can do that. But then all of a sudden, you need new tires for your car. Your kid falls off the bike and breaks their arm, so you got a big doctor bill. The storm comes through and blows some shingles off your house. All of a sudden, that $370 is gone and you're upside down, right? I think that's what happens, is that people go along with a root canal or a cavitation for a while, and they're struggling, but they get by. And then all of a sudden, there are these extra electron stealers that come along, drop the voltage all the way to zero, which flips the polarity, and bingo, you've got a malignancy. Okay, so I want to switch gears for a moment now and talk to you about something that I find is present in the majority of people that I see in my clinic. And I've named this the gallbladder wisdom tooth emotion syndrome. It's kind of long, but I think it explains what I'm going to tell you. So to understand this syndrome, you must first understand adrenal function. Now, people have a tendency to say, well, my adrenals are shot, but nobody can tell you much about what that means. And the reason is that the adrenal glands are actually two separate glands in one. It should be thought of as two separate glands because they function differently. The outer portion of the cortex makes cortisol, aldosterone, and testosterone, while the medulla, or the inside of the adrenal, makes adrenaline. And those hormones have completely different effects. Now, if you talk about the adrenal cortex and the fact that it makes cortisol, aldosterone, and testosterone, it's my clinical impression, although I don't have the data to back this up yet, that when the cortex gets stimulated, you get a little squirt of each of these, not just one of them. Because what you will see is that people who have the problems have symptoms that are characteristic of each of these. So cortisol has to do with blood sugar and inflammation. Aldosterone is the amount of sodium retained, and thus it's the amount of fluid that you have. And testosterone has to do with sexual function, brain fog, and male features such as muscle strength. Now, I wanted to take a moment and talk about aldosterone because it's my observation that people who have overactivity of the adrenal cortex have high systolic pressure and who have inadequate amounts of adrenal cortex hormone or function have low systolic pressure. And that, of course, makes sense once you think about it. When the heart beats and squeezes, how high the blood pressure goes is dictated by the total volume of fluid inside the vascular tree, right? Of course, theirs has to do with, but we're assuming that in a normal pump, a normal heart. So since the fluid volume is dictated by the amount of sodium retained by the kidneys and thus the amount of water retained by the kidneys, and thus the intravascular fluid volume, aldosterone is primarily in control of systolic pressure. So what we'll show you, well, I'll just go ahead and tell you here, the diastolic pressure, of course, is controlled in part by how much resistance there is in the vascular tree when the heart is at rest, right? And that's determined mostly by the vasoconstriction of the peripheral vascular tree, which is controlled by adrenaline and nitric oxide. So what you will see is that measuring the blood pressure in people who are not on blood pressure medicine is a great way to identify, probably in my opinion, a better way to identify adrenal function than blood tests or saliva tests or urine tests or any of those other tests. If a person has a high systolic pressure, they are overstimulating the adrenal cortex. If they have a low systolic pressure, the adrenal cortex is not functioning very well. Same for the diastolic pressure. If it's high, the people are overstimulating the medulla and thus have too much adrenaline. But if it's low, you will see that they are deficient in adrenaline. Now, what happens to us when we have these? Well, in both men and women, when cortisol is high, we notice that normal thinking becomes easily confused and frazzled when rushed or under pressure. We have swelling, water retention of the fingers, ankles, or limbs, or the face. We have high heart palpitations or high systolic blood pressure, unhealthy thinning of the skin, easily bruised, excessively oily skin, increased facial or body hair, which, by the way, is the testosterone piece, sleep problems, staying awake much of the night, elevated triglycerides, sugar cravings, sugar imbalance, muscle weakness, decreased muscle mass, restless leg syndrome, generalized ongoing excessive tension all day long, constant low-grade headache for days on end. On the other hand, with low cortisol, we have sweating or wetness of the hands when nervous, excessive sensitivity to chemicals, low tolerance for alcohol, caffeine, or other drugs or strong odors, unusual fatigue, especially in the morning, with more energy after meals and later as the day progresses, having better energy at night when others are winding down, salt cravings, a lack of thirst. Markedly low blood sugar and hypoglycemia. For example, you can't skip a meal, or you get really grumpy, needing snacks just to function, tired but wired feeling, low reserve, not much extra oomph, thinner, dry skin, brown spots on the face, intolerance to exercise, prolonged low systolic blood pressure. And of course, we talked about aldosterone. And what about testosterone? With decreased testosterone, we get decreased mental ability, decreased memory, noticeable foggy thinking, decreased erection or sexual performance, or decreased sex drive. Note that, by the way, ED is not only lack of testosterone, but it's due to low adrenaline, low nitric oxide, but perhaps most importantly is low voltage in the spleen stomach meridian. Noticeable decrease in muscle mass, apathy, not caring much what happens, slowed urine stream, increased urinary urges, feeling of being burnt out. And the list goes on and on and on. So the majority of people that I see in my clinic, and by the way, in my clinic, I rarely see anybody who's well. Almost everybody that comes to see me has been sick for 5 to 15 years and can't figure out what's wrong. So that's the group of people I normally see. But here is characteristic of most of the people I see. First of all, they have trouble with insomnia. Next, they have trouble dealing with stress. Next, they have trouble with their memory. And then they can't multitask. So you're sitting reading a book and somebody says, hey, do you want mustard or mayonnaise? You become annoyed because they interrupted you. But you don't have enough mental horsepower to stay attached to your book and make the decision, so you detach. You pick mustard, you go back to your book, and you can't remember your place, and now you're really annoyed. And then you can't stand stimulus. So you don't like loud noises, loud music, rowdy crowds. You can't be around people who are arguing. And eventually, you don't even want to be touched. You just want to sit in a corner and have people leave you the heck alone. And then your sexual equipment quits working, and then you can't go to sleep before 11, and when you wake up, you're still tired. That whole syndrome that I just described will resonate with probably the majority of people in this room, at least to some degree. It's a slippery slope, and most people are somewhere on that slope. Now, the problem with having lack of adrenaline, which is the cause of all of that, is that it destroys your life. If every time somebody wants to interact with you, you are grumpy and to the place of anger, they don't want to have anything to do with you. If you don't like to be touched, if your sexual equipment doesn't work, it's very difficult to be a good spouse, isn't it? If every time somebody wants to talk to you, you brush them off, it's hard to be a good friend or a worker, isn't it? And by the way, those of us who are parents recognize that perhaps the best definition I've ever heard of a boy is a noise with dirt on it. And of course, kids are always mommy, 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 or daddy, 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 right? If you don't have adrenaline, you can't deal with that. No matter how much you love the kids, you can't deal with that, so you brush them away, and that destroys that relationship. So what I'm trying to explain to you is you must come to realize that most of people's lives who end up in divorce, who end up with kids and their parents who can't get along, who end up with people on drugs because they can't quite cope any other way, almost all of these people have lack of adrenaline. Now, to make adrenaline requires vitamin C, vitamin B6, thiamine, and the voltage to make the adrenals work. Now, I put together this supplement that has exactly those things in it, and I can tell you that it helps a little bit, but not a lot. And the reason is that it doesn't help a lot is that even if the body has the nutrients to make something, unless the organ that uses those nutrients has the voltage to do it, it still doesn't work, right? So not only do you have to give these supplements, but you have to correct the voltage in the spleen acupuncture muscle battery pack, because that's a battery pack for the adrenals. Now, again, to understand these battery packs, here in the spleen meridian, you know, it started in the toe, goes up to the female genitalia, comes around to the back, and here, of course, is where the power supply for the adrenals come from, is the spleen meridian. And then, of course, the stomach meridian has the thinking part of the brain, et cetera. Now, notice that when we look at the circuit breakers for these circuits, the two that are really interesting to us are the wisdom teeth and the upper molars, because that's spleen stomach. Now, the wisdom teeth are the power supply for the heart, the small intestine, and the autonomic nervous system. So when you have a switch that's off in the wisdom teeth, you take out the autonomic nervous system. And of course, that's your control panel, isn't it? If your autonomic nervous system doesn't work correctly, nothing works correctly. It's like flying an airplane without any instruments in the cockpit. But then notice that right next door is spleen stomach, which again is the thinking part of your brain, as well as your entire endocrine system, as well as your entire sexual function system. Now, one of the problems, I think, is that for many years, when dentists pulled any tooth, but particularly wisdom tooth, they ignored the ligament. So it's simply wiggle the tooth around until it breaks free from the ligament, take it out, put a stitch in and quit, and leave the ligament behind. And of course, that creates a problem because the bone has trouble healing with that ligament in the way. And so you end up with this kind of a thing, which I think you could see if you've got an electronic circuit going through here, how that could interrupt that and act like a circuit breaker. Now, the problem, of course, with when you have cavitations like this is that they can easily slide next door and take out the next door neighbor's circuit as well. So what you see happen is that people who have wisdom teeth infections, it comes over and knocks out the spleen stomach circuit. Now, on the lower part, where the infected wisdom teeth area comes over and knocks out lung, large intestine. So, but in this particular syndrome that I'm talking about, most commonly it's the upper ones, which takes out heart, small intestine, autonomic system, your entire endocrine system, and your entire reproductive system. So, now, here you can see, of course, where there's just been made a slit in the gum and the gum's been pushed aside to show where a tooth had been pulled, and of course that should be solid bone, but of course it's not. And as you can see, you've got all of this gleep down in there from the infection and the ligament rotting and being in the way. And here you'll see the ligament come out. And again, I think it's easy to see how not only can this be an electronic circuit breaker, but as Dr. Haley's shown, one of these things can shut down 63% of your immune system. So again, you can see how that can also spread to the next door neighbor and take out spleen stomach. Now, to decide whether or not you have this has been difficult because often you don't see these on standard dental x-rays, which of course has a resolution of about a millimeter, whereas a cone beam scan has a resolution of 1/10 of a millimeter. But even with a cone beam scan, I find that oftentimes it's missed. But you cannot miss an electronic circuit being out. So what I want to do is to teach you what I think is the most predictable and accurate test for having cavitations in the wisdom teeth. So what you do is you have the person that you're trying to question, have them put their thumb and their ring finger together and make a ring. And then what you do is that you pull on that, and you're pulling just enough to teach them how strong they are. So again, I want to emphasize, this is not a test to see whether you're stronger than your patient. It's you are trying to teach your patient how strong they are. So I want you to do that to your next door neighbor. Please do that. All right, all you get together, teach your neighbor, each one of you teach each other how strong they are. Again, it's thumb to ring finger. All right, again. So you just put your fingers in and you pull just enough to teach them how strong they are. Did you do it? All right, so do that to each other. All right, now what I want you to do is I wanted you to have the patient take their opposite hand and using the index and the middle fingers, put them over where you think the wisdom teeth are, which is approximately an inch in front of the ear hole, right? Right about there, just in front, as you can see here, about an inch anterior is where the wisdom teeth are, the molars a little farther. But so what you do is you have them put their two fingers over the area and now check and see how strong they are. If they are weaker when they're touching it than they are when they're not touching it, you can take it to the bank, there's a cavitation there. So I'm going to give you just a moment to check each other. Okay, and you can do this same thing if a person has a root canal tooth. Put your fingers, check and see how strong they are. Put your fingers over the root canal tooth, and if they go weak, you can take it to the bank that is causing an electronic short in that circuit. Now notice in this kind of muscle testing, there are no questions asked. There's no possibility for this to fail. When people use muscle testing, like if I say, your problem is gallbladder and I'm testing something, I'm asking a question and there's room for error. But in this, there is no question asked. You're simply checking how strong they are, and if they touch a short or a ground in their electronic system and they go weak, guess what? There's infection there. I've never seen this fail. I've seen cases where this was abnormal. Cone beam scans were read as normal, but the dentists go in anyway, and it's a mess in there. All right? So I would hope that each of you dentists will begin to make this standard of practice as I do. When a patient comes in and I'm doing their physical exam, I always do this test over their wisdom teeth and over any root canal that they have. And almost always you will see this correlation between the symptomatology that I just described and this test being abnormal. So here's what bone looks like. And obviously there are a lot of places in here for bugs to hide, so no matter how much you wash it out, it still has a tendency to get infected. And so, of course, what's becoming standard is to fill a syringe with ozone gas. Since ozone will kill any bug, put that little tip down and blow ozone into that bone and sterilize it. Once you've done that, you come behind it, of course, and draw the blood out of the arm, spin it down the centrifuge to make fibrin form, because as you know, fibrin contains all of the healing factors that will make bone heal, and then you cut a chunk of that off and stuff it down in the tooth, and they heal like magic. So many times when you pull teeth, particularly wisdom teeth, you get dry sockets, which by definition means you're going to have a cavitation there. But when you use ozone and platelet-rich fibrin, it is very, very rare to have an infection. And most of the time when my patients have this done, I find the majority of them don't even use pain pills. The ozone and platelet-rich fibrin causes the healing to be so much better that about the only annoyance is the 10 days of scratchiness from these dissolvable stitches. what I have found, both personally and with my patients, is that when cavitations are fixed without ozone and platelet-rich fibrin, that they tend to return in about 2 or 3 years, and you have to do it all over again. But once you use ozone and platelet-rich fibrin, you almost never have a recurrence. For that reason, I only refer patients to dentists who use both ozone and platelet-rich fibrin. What I've been amazed about is that when people have this done, have this completed, that usually within a week, it's like you flipped a switch and they've got their life back. And it's just dramatic how much difference you can make in people's life. They go from their life in the toilet to being back to productive citizens again, marriages get back together, people resolve issues. And so you dentists are really at the forefront of being able to help people with this kind of problem. So it's 10:30. Can I have 5 more minutes? Yeah, okay. So I just wanted to show you some case studies. So here's a 61-year-old with weight loss and hearing loss, macular degeneration, and that sort of problem. And what I do for patients is I simply make a list of whatever their symptoms are like that, and then I come behind it and say, what's the power supply for that symptom? Well, the thyroid gland's on the stomach meridian. The heart arrhythmia, people who have heart disease, guess what? Wisdom teeth problems. So if you have somebody with angina or you have somebody with arrhythmia, it's almost always wisdom teeth plus nitric oxide deficiency. And so you go down the list of everything that's going on, and what you begin to see is there eventually you see a pattern over here of what circuits are involved, and then we measure the voltages and their circuits, and in this particular methodology of measuring, you take the number this machine gets and divide it in half to get millivolts. So although this patient's running at approximately 27.5 millivolts on the average, if you look at the other circuits that are going on, for example, this one is at 16 and 12, so they're running at about half voltage in their spleen circuit, which corresponds to the symptomatology they have. And of course, when you do this test, what you find is that their wisdom teeth are out and have taken the spleen stomach circuit out. So the way that you fix that patient's problem is, again, you send them to the biological dentist who does their cavitation surgery, and then they're well. Again, the O-ring test shows it best. And then here's another example, an 18-year-old who has Crohn's disease with all sorts of GI stuff, and has been unable to go to school. And of course, when you start making the list over here, you begin to see the commonalities. You begin to see it. So again, guess what it takes to get this 18-year-old back to normal? What's the power supply or what's the tooth that controls small intestine? Wisdom teeth. And what controls the heart? Wisdom teeth. So it very quickly, and then you've got all of these adrenal symptoms, so you very quickly begin to see that this person is sick and has Crohn's disease because of their wisdom teeth extractions. Who would have guessed? Well, look, here are the wisdom teeth circuits: heart, small intestine, autonomic. Here's the lower molar, here's lower molar, and here's another thing that I'll mention in a moment. But just right here, seeing that look how low the voltage is in the sympathetic system, 2.2 millivolts on the right, and just a little over 1 millivolt on the left. And it should be what? 25. So obviously this person's in trouble. Now there's one other thing that this tells you, and that is, when you see that there's low voltage in the gallbladder circuit and higher voltage than normal in the liver circuit, that's almost always emotional baggage, because emotions tend to get stuck as magnetic fields in the gallbladder circuit, because the gallbladder circuit is the power supply to the amygdala, and the amygdala is controls all sensory input. Well, in the hour I've been given to speak with you, I have hoped to relate to you the fact that, in my experience, people with malignancies cannot get well and stay well unless they, at least 96% of them, will have to make a trip and be treated by a knowledgeable biological dentist who uses ozone and platelet-rich fibrin. And then I've also tried to tell you that the majority of patients I see with chronic illnesses, whether their life's in the toilet or from a lack of adrenaline, or whether they just are ill from something else like Crohn's disease, nothing that I know to do makes them well. I can get them better by correcting their digestive system, correcting their vitamin and mineral deficiencies, correcting their diet, using the biomodulator and fixing their autonomic nervous system each day. But they never get completely well until they go to the dentist. So it's my view that biological dentists are the guardians of all of our health as it relates to chronic disease. So I salute each of you. Thank you.